Today, we are covering cardiovascular medications, a topic the NCLEX loves to test with priority and safety questions. Let's start with ACE inhibitors, which you'll recognize by their generic name ending in pril, like lisinopril. The exam doesn't just want you to know they lower blood pressure. It wants to know if you can spot a life-threatening adverse effect. An exam question might describe a patient on lisinopril who reports a tingling sensation and swelling in their lips and tongue. This is angioedema, and it's a medical emergency because the airway can close. Your first action is not to call the doctor or check their blood pressure. It is to assess the airway. Another common side effect is a persistent, dry, hacking cough. While not life-threatening, it's a frequent reason for switching medications. A great way to remember the key points for ACE inhibitors is the mnemonic APRIL, which stands for angioedema, potassium elevation, so you must monitor potassium levels, renal impairment, irritating cough, and low blood pressure. Next are beta blockers, the drugs that end in lol, like metoprolol and carvedilol. Think of them as putting a lull on the heart, slowing it down and reducing its workload. The number one safety check, and a guaranteed exam question, is assessing the patient's vital signs before administration. You must check the apical pulse for 1 full minute and check the blood pressure. The NCLEX will give you a scenario where the patient's heart rate is 58 beats per minute. Your correct action is to hold the dose and notify the healthcare provider. Giving a beta blocker to a patient with a heart rate below 60 is a common exam trap that tests your clinical judgment and safety awareness. Now let's discuss digoxin, a cardiac glycoside with a very narrow therapeutic range, making toxicity a major concern for exam questions. Just like with beta blockers, you must check the apical pulse for a full minute and hold the dose for a rate below 60. The NCLEX loves to test on the signs of digoxin toxicity. A classic question will present a patient on digoxin who reports loss of appetite, nausea, and seeing yellow-green halos around lights. These are hallmark signs of toxicity. The exam will also try to trick you by testing the relationship between potassium and digoxin. Remember that hypokalemia, a low potassium level, significantly increases the risk of digoxin toxicity. So, if a patient is on digoxin and a potassium-wasting diuretic like furosemide, you must be extra vigilant for signs of toxicity. Let's move to calcium channel blockers, such as diltiazem and nifedipine. These drugs relax vascular smooth muscle, leading to decreased blood pressure. A key patient teaching point that frequently appears on the exam is the avoidance of grapefruit juice. Grapefruit juice can increase the drug's concentration in the blood, leading to severe hypotension. The exam will test this by asking what patient statement indicates a need for further teaching. If the patient says they enjoy a glass of grapefruit juice with their breakfast, that's your red flag. Finally, we have the anticoagulants, specifically heparin and warfarin. The exam expects you to know the difference in monitoring and their reversal agents. For a patient on a heparin infusion, you monitor the activated partial thromboplastin time, or aPTT. The antidote for heparin is protamine sulfate. For warfarin, also known as Coumadin, you monitor the prothrombin time and international normalized ratio, or PT and INR. The antidote for warfarin is vitamin K. The NCLEX will present a scenario with a critically high lab value for one of these drugs and ask for the appropriate antidote. Do not mix them up, as this is a common point of confusion they use to trap test takers.